Now we're ready to get started with the training. To start using your NovoPen4, pull off the cap and twist the pen apart a quarter turn counterclockwise. Next, if the piston rod is not already returned, return it by simply pressing the piston rod head in with your finger until it stops and you hear and/or feel a click. The durable piston rod is made of high-grade metal. The click is there to provide an audible confirmation that the piston rod has been fully returned. Now it's time to insert the Penfill cartridge into the Penfill cartridge holder. Always make sure that you're using the correct type of insulin and be sure to insert the colored end of the cartridge first. Now twist the NovoPen4 back together until you hear and/or feel a click. If your insulin cartridge contains a cloudy insulin, also called an insulin suspension, be sure to mix it by rolling it 10 times and then shaking it 10 times. Now it's time to attach the needle. Remove the protective tab and screw on a new disposable NovoFine needle onto the color-coded cap. Remove the outer needle cap and keep it for after you've made your injection. Now remove the inner needle cap and dispose of it. At this point, you're ready to check the insulin flow by priming the pen. You should always check the insulin flow before each injection. First, pull out the dose button, if it's not already pulled out, and turn it to select either 4 units with a new Penfill cartridge or 1 unit with a cartridge already in use. Hold your NovoPen4 with the needle pointing upwards. Tap the Penfill cartridge holder gently with your finger a few times to raise any air bubbles to the top of the cartridge. Press the dose button completely in until you hear and/or feel a click. The display will return to 0. A drop of insulin must appear at the needle tip. If not, repeat the priming procedure until a drop of insulin appears. Now that your pen is ready and primed, you're ready to select a dose. Pull out the dose button if it is not already pulled out and turn it in either direction until your required dose lines up with the dose indicator. Your healthcare provider will recommend where and how you should inject. Areas may include the upper side area of your arms, your abdomen, except the area close to your navel, the front and sides of your thighs, and the upper and outer surfaces of your buttocks. Once you've selected your insulin dose, you're ready to make the injection. First, insert the needle under the skin at a 90-degree angle. This is recommended for most adults, but you should always follow the instructions of your healthcare provider. Now, push the dose button all the way in until you hear and/or feel a click. Keep the needle under your skin for at least 6 seconds to make sure you have injected all of the insulin. Withdraw the needle. Your injection is now complete and the selected insulin dose has been delivered. That's it, you're done. Now that you've finished your injection, carefully replace the outer needle cap onto the needle. Hold the cartridge holder and unscrew the needle. Be sure to dispose of the needle properly and replace the pen cap after each and every use. Now that you know how to use your NovoPen4, here are a few more tips for checking, maintaining and caring for it. It is important to ensure that your NovoPen4 is always working properly. This is a simple test you can do to ensure it is functioning correctly and releasing the right amount of insulin. First, check that the Penfill cartridge is intact and that it has no cracks. Next, make sure the NovoPen4 is screwed properly together. Screw on a new NovoFine disposable needle. Prime the pen like you learned earlier. Put the outer needle cap onto the needle, making sure the inner needle cap is removed from the needle. Select 20 units on the dose dial. Dispense the insulin into the outer needle cap by pressing the dose button completely in until you hear and/or feel a click. The insulin should fill the lower part of the outer needle cap as you see here. If the pen has released too much or too little insulin, try the test again. If it still releases an incorrect amount, do not use your NovoPen4 and contact your supplier. Here are a few simple tips for taking care of your NovoPen4. The good news is that there is no maintenance other than cleaning it with a dry soft brush or cotton wool moistened with a mild detergent. You should protect your NovoPen4 against direct sunlight, water, dust and dirt, and avoid dropping it or knocking it against hard surfaces. When a Penfill cartridge is inserted, store your NovoPen4 at room temperature. Keep your NovoPen4 in the case supplied whenever possible. For more information or for troubleshooting help, you can always refer to the user guide that came with your NovoPen4. Here are some frequently asked questions about the NovoPen4. How many units of insulin can be dialed on my NovoPen4? 1 to 60 unit doses can be dialed in 1 unit increments on your NovoPen4. Is it normal for the dose button on my NovoPen4 to click back out on its own after injecting? Yes, it is normal for the button to sometimes click back out. It will not affect your dose. Can NovoPen4 be dialed backward? Yes, the dose button can be turned in either direction before an injection to correct a dose. This will not waste any insulin. Why is insulin leaking from the NovoPen4 device? Insulin will occasionally leak out of the needle right after injection. We recommend leaving the needle under the skin for at least 6 seconds after fully depressing the button. Is it okay to dial the NovoPen4 device back to 0 rather than pushing the button down? No, you cannot deliver your dose by dialing the dose button backwards. This will reset your dose but not deliver any insulin.